So we're very pleased here at hVIVO to launch our first Omicron challenge model. It's a major milestone for the company. As you know, last year we were the first commercial organization to run a COVID challenge trial, which we did successfully. It got published in a leading scientific journal called Nature Medicine. And the next step for us is to go with the times and develop this hugely significant Omicron challenge model. So we're very pleased to announce that not only are we starting the development, we in fact also have our first customer on board too. So the reason why we have developed we're starting to develop the Omicron challenge model now is that the Omicron variant has a different behavior to the previous variants, in that even if you are fully vaccinated, you can still get infected. In fact, there's also a high probability of having a reinfection with the same virus. And for us to be able to do our challenge studies, we need to ensure that we can infect a certain proportion of our healthy volunteers. So this is why Omicron is an ideal variant when it comes to performing challenge studies with. We've also had a huge interest from our client base wanting us to build this. So I think the timing is right. We have a huge interest, the market is there, and we have the scientific expertise that has shown that they can deliver COVID challenge models before. So the timing for the Omicron challenge model is that we will be manufacturing the virus this year. We plan to conduct the characterization study, which is a study used to find the right dose of the challenge agent in early next year. And then around mid-23, we will be performing our first challenge study. So the timing and the planning is already there, but hopefully come mid-2023, we will have a fully fledged Omicron challenge model for us to be able to help all our clients in fighting the pandemic. Patient and volunteer recruitment is the biggest challenge when it comes to clinical trials. We have this very big machine in FluCamp, a platform that we utilize for media and also online social media advertisements. So we use Facebook, we use Instagram or TikTok and so on to be able to recruit our healthy volunteers. We have a screening site here in London, also one in Manchester, with the capacity to screen over 1,000 healthy volunteers every week. So we understand the challenge ahead of us when it comes to recruitment, and we are ready for it. We have shown ourselves in the past to be able to deliver these studies time and time again, and I have no doubt that the team here is going to do a wonderful job in delivering this Omicron challenge studies.
To manufacture the challenge virus, the first thing we've done is we've collected samples from people who have been naturally infected in the community. So these are people who have already tested positive for COVID. So we go for an informed consent for them, and then we collect their sample, we take it to our laboratories and it's stored down in the laboratory. And then the next stage is we need to take those samples and see which ones have viable virus. So by viable virus, I mean, is there infectious virus contained within these materials so we can grow the virus on. And those that grow, we then grow them essentially under medical grade conditions. What we're doing is producing a purified version of the virus under really controlled conditions, under GMP, so good manufacturing conditions, just like a product would be made for any other human product. And what that means is then we then take that virus into a GMP condition, produce this purified product, and then test the product to make sure it's safe for human use. We're making sure, of course, there are no other contaminants in there. So the only pathogen, for example, in there is going to be the Omicron virus. We're making sure there's no other contaminants in there, and that therefore it is safe to move forward with for human trials. A characterization study is really the first step of looking at the virus we've made and making sure it's therefore ready for testing products with. So really what we're doing is identifying how much virus do we need to give to the volunteers to get a reproducible infection. So we start with a really low amount of virus, and if nobody gets infected, then we give the next group of volunteers a slightly larger amount of virus. And then we stop as soon as we're able to give enough virus that we're causing an infection into the subjects. At that point, we're then ready to move forward with the next phase of testing, where we're actually able to test in challenge studies the efficacy of products, whether that be vaccines or antivirals. hVIVO has a great deal of experience with COVID-19 work already, both in the laboratory and in the clinic. So starting with the laboratory, we have independent contracts coming into the laboratory where we test that very early proof of concept. Does my product work against the virus? So testing in cell culture in a laboratory. Secondly, from a manufacturing perspective, This will be the third challenge virus we've produced. We've produced a Wuhan-like challenge strain. We've also produced a Delta virus strain. Now the Omicron virus will be the variant, the third one we've produced as a challenge virus. The Wuhan virus, which was the first one we produced, has already been in clinical trials. So we conducted a clinical trial for that study where we had 36 individual volunteers, seronegative volunteers who had not been vaccinated, and we put them into a clinical trial and demonstrated you can do challenge studies safely with COVID-19. Since then, that virus has also been used by Oxford University to do a challenge study as well. So others are now doing these studies in academic ways. And now we're taking this model forward and transferring it to a model to make it up to date. So we're updating it with Omicron, and we're also updating it to make sure the population is representative of the current populations, that is targeting a vaccinated population. So this model, we believe, will be a great impact to helping more products come forward, because well, it's great that we got vaccines available and the vaccines were efficacious. Of course, this first wave of vaccines haven't answered all of the questions. We still need to be having boosters, and they still don't have the greatest durability, i.e., the immunity wanes over time. So can we get vaccines which we can last once every 5 years, for example, rather than once every 6 months? Or can we get vaccines where there's no cold chain issues, i.e. that you don't have to keep it cold throughout, to make it much easier to use in developing countries where cold chain can be very difficult. So there's still a need for updated and new and improved vaccines, as well as a need to have new antivirals. Having a challenge model available really helps get those products to market very much quicker. We can identify whether a product's working in challenge studies with a really small number of volunteers, which means you get that answer very, very quickly, other than having to go to the tens of thousands of volunteers that you may need to do vaccine trials, for example, for a field trial.